Hello viewers, welcome to Generations Gist with Joy. This show is here to x-ray and showcase how generational transition and individual experiences and relationships have impacted and shaped contemporary human behavior and national development and advancement. Today's discussion promises to be refreshing and inspiring. Just stay relaxed and enjoy it. I am your host, Joy Onu. But before we move on, let's go on a short break. Please stay tuned.
The world is no longer a global village. It is a neighborhood. Generations come and go, but the gist they start lingers. The platform that sustains those gists is here. Be a part of the conversation on Generations Gist with Joy. From policymakers to politicians, medical personnel to traders, labor leaders to students, the young and the old. It's Generations Gist with Joy on this channel every Saturday at 9 a.m. with a repeat broadcast on Sunday at 9 a.m.
It's your generation, it's my generation, it's our generation.
Come, let's tag along on Generations Gist with Joy. Please join us.
You are welcome back. Today we shall be talking about mental trauma and the impact on national identity. Psychological or mental trauma can be defined as an emotional response caused by severe distressing events that shatter one's sense of security, making them feel helpless and leaving them struggling with upsetting emotions, memories, and anxiety that does not seem to go away. And national identity is a person's sense of belonging to a nation or state. A strong national identity can lead to devotion to one state or country as more important than other interests. And according to social researcher, mental trauma experienced by a significant portion of a population can profoundly impact a nation's identity by shaping collective memory, influencing social behaviors, and potentially leading to a fractured sense of belonging, particularly when the trauma is linked to historical events or widespread societal issues like war, genocide, or natural disaster. In such cases, trauma can, however, thwart or impact citizens' mindset on their national identity, causing loss of interest in their respective country, leading to mass exodus of citizens to other nationality. And in fact, I have a very important personality with me in the studio to help discuss and enlighten us on this very crucial and important topic. This person is a foremost licensed complementary and alternative medical practitioner. He's a certified energy health practitioner and energy therapy consultant. In all, he is an energy therapist for emotional trauma resolution and mental health advocate who is vigorously promoting energy psychology and energy medicine in Nigeria. I am highly delighted to welcome Chief James Berian IWOWARRI.
Thank you very much.
Chief IWOWARRI, you are really welcome to this show. I'm really glad to have you on the show.
Thank you. I'm glad to be here too myself.
Thank you so much. And you know, there was a time we had a mental health issue program on this show, but hearing about what you are doing, about the energy therapy and all those things, I said, no, it's very important. You come here to enlighten the people on what that is. And you know, you are focused on mental trauma, you know. And the first question, let me ask you, what is mental trauma? Or is it post-traumatic disorder? And how does it affect identity and even national identity.
Mental health is when you are able to think properly, to take decisions properly, to act in a normal and natural way without interferences, without using substances and whatever enhancers to keep yourself stable so that you can function. So the ability to function without any extraneous aids and functioning effectively within the society at whatever level you want to function is then regarded as somebody who is mentally balanced. The opposite of it is now the issue. If you cannot function effectively without enhancers, then there is a problem. And that problem can come from a myriad of factors: traumatic experiences, physiological issues also, because if you fall down or you have a tumor in your brain, it could affect the chemical balance in the brain that could lead to mental health challenge. But if you have also emotional health challenges that have dragged over a period of time without resolution, it could lead to also mental health challenge. The problem with mental health in our environment is that what people have identified as mental health is usually the extreme part of it, which is either psychosis or what people call madness, schizophrenic conditions, and so on. And because there had been no organized way of dealing with these situations, sometimes people are dealt with in a way that is a little bit violent. You have people in chains, you have to drag them. So that is the kind of thing that people see or imagine when we talk about mental health. But mental health has so many other aspects. We have the emotional health, we have the psychiatric health. The psychiatric health is the one that people remember or see when they talk about mental health. But the emotional aspect, which is even higher in manifestation, is not given consideration. So that's in my activities now. I try to help people to distinguish between mental health, which is the psychiatric health as people perceive it, and emotional health.
Okay, now let me ask you, what is actually the similarities and the difference between the mental health, which is more like the psychiatric issues, and the mental trauma, which we are talking about, or the emotional trauma? Yes. Is it emotional trauma or mental trauma?
No, that's emotional trauma. There is psychological trauma. There is also mental trauma. That's the trauma. Let us look at trauma first. It is a word that applies in two different areas: physiological trauma or physical trauma, and the emotional trauma. Physical trauma is when you climb up and you fall. Maybe you break leg, you cut hand, you are involved in an accident and you have physical damage. That's trauma. You have to get to the hospital and deal with it. The emotional trauma is the one that happens when somebody does something that you do not like or that you feel hurt.
Yeah,
I talk about this as a shocking experience that is overwhelming. That when it happens, you don't have control over it. You are not stable to take decision at that particular point in time. You are kind of disoriented when it happens. Now, this emotional trauma, so many people go experience it, but they do not know what to do when it happens. In the case of physical trauma, you can go to the hospital immediately. People will see you and say, oh, you have injury, quickly go and get first aid. Okay,
now the question I asked was, what is the difference between the trauma, between this emotional trauma, which is the mental trauma, and is it physiological trauma now, or the one we call madness or mental health?
The psychiatric challenge comes from the head.
Okay.
The emotional health issue is from the heart.
Okay.
You get the point? So, but people mix the two. Even in the academics, we mix the two. So the heart one, when somebody says, I am heartbroken, that means there is an emotional weight that created a disorientation at the heart level.
Okay.
It is not a health thing.
Okay.
But if you leave it and you start bothering yourself and getting worried over time, it might now create hormonal challenges, imbalances that will now affect your mental coordination. And that will now become a psychiatric issue.
Then what are the long effects of trauma on victims, and is it actually treatable? I mean trauma now,
Yes.
emotional, mental trauma.
Yes. If it is physical trauma, you can be treated. Go to the hospital and they deal with it. Emotional trauma can also be treated. The effect of unresolved trauma can lead to mental, what we call post-traumatic stress disorder,
Yeah.
PTSD. Now, when it gets to that level, there are stages before it gets to that level. When it gets to that level, there are certain behavioral patterns that would manifest. You will begin to feel sad. You are constantly sad. You feel that somebody is talking about you even when nobody is talking about you. You will get easily startled. You might begin to experience symptoms of depression, you know. So these are the things that can happen when you get to that level of post-traumatic stress disorder. You may also become a lot more anxious, you know. You become afraid in public, in private. You may develop phobia for things or for you know, activities. So these are signs that something is wrong. And when it gets to that level, sometimes you may even begin to lock yourself up. You become antisocial. You now isolate yourself. People, your reaction towards people will become antagonistic, so to say, because you're always angry.
Yeah.
You get enraged. So these are signs that the individual has been deeply traumatized and he has not resolved that trauma.
So at this point, what would you say they should do, and at what point in your own therapy, because we're actually coming to all those things, in your own view now, at what point can somebody not, maybe you are not attending to the person, the traumatized person now, at what point does that person need to seek help, either medical help or therapeutic help?
Anytime an individual experiences a traumatic experience, what I call life event experiences, the person needs to get treatment. He shouldn't wait. What people do is that they wait, they manage it, maybe because they don't know where to go to. Now it is possible to, where to go to is available. Everybody who experiences a traumatic experience or who goes through a traumatic experience needs to seek help immediately. Because if it is not resolved, people will put their emotional response to these traumatic experiences into their emotional bank account.
Okay.
Everybody has it. And they lock it up. And they continue to accumulate these emotions in the emotional bank account until one day, when they can no longer keep it, they erupt.
As a therapist, what are those things? Because we live in a society, especially in Nigeria here, where it is very difficult to tell somebody about what you are going through. You know, I know that some trauma issue are something you don't even expect, like the war, like the area where they do some kind of kidnapping and all those things. Those in rehabilitation and homes, they keep them. So
IDPs.
I heard the IDPs and so on. Those kind of people, you know, they are not even aware of anything, you know. So at what point, and who is supposed to go and talk to them or attend to them to be able to assess this kind of thing? And on the milder part, personal issues that could make you go through those traumatic situations?
Now, let me start from the first principle, because that is where we need to understand it. What are the things that cause trauma? Unfulfilled expectations can cause you trauma. People's behavior towards you can cause you trauma. So you find that the people who can be traumatized, everybody can be traumatized, anybody can be traumatized. And they start from children. Even children that are carried in the womb can be traumatized, because when the mother is traumatized, it goes through the cord and then the child experiences it. When a mother falls who is pregnant, the child receives shock. Remember, I said that trauma is shock that you don't have control over when it happens. Now, when the child is born, the child goes through also traumatic experiences in the hands of parents. You know, and it could also be as a result of bad environment where the child is growing up, the kind of uncles and aunties the child has, the kind of social network the parents have, and you know that the child is exposed to. These can be traumatizing to a child. So it is documented that many children go through what is called adverse childhood experiences, or you call them childhood trauma. And these affect the development of the child eventually, and also causes the behavioral pattern as exhibited by an adult. So that is what we need to know. Now, what are when an adult experiences trauma, what are the causes? We talk about road traffic accidents. We talk about kidnapping, you mentioned. We talk about this challenge of displacement.
Okay,
you know, being a refugee.
No, what I was actually asking, that is a bigger part, like the refugees and so on, is a bigger part. Perhaps maybe government will want to come in those areas. But the psychological feelings of individuals, personal, like for example, you know, I have an issue within me or around, then I keep it because of the societal values and the rest of them. So who are those people that should actually, because of this psychological or maybe the societal values now, many people could not or does not want to access a medical treatment or even therapy. So now that you that is in this thing, what are you people doing? Maybe a body of therapists, a body of psychiatrists or psychologists, to be able to make it, you know, known to a lot of people, even to the grassroots.
The objective of our interaction now is to bring this information to the public, that people should pay attention to their emotional well-being and take steps to recover from them if they have emotional health challenges. The societal programming of itself to make it difficult for people to seek help is wrong. It is very, very bad. People should be free on themselves to seek help when they have challenges. People should not be afraid. They should not feel ashamed. That is also a problem, because a lot of people are ashamed to go and seek help. But who is affected in that process? It is the individual. I've had to counsel people who, you know, somebody, in fact, a few days ago, said you need to take your emotional well-being in your own hands. It doesn't depend on anybody. So, but the challenge is that of awareness. And I started earlier by talking about having to become an advocate of mental health, emotional health, so that people will become aware. Yes, groups can come in. I'm happy now that a lot of groups are coming in, a lot of NGOs are coming in to talk about it. It wasn't like this 10, 15 years ago when I was active talking about it. My first workshop in Lagos was on anger management, and somebody was asking me, "Doctor, do you think that anger can be treated?" I said, anger, it can be treated. Yes. So people don't know, and when they don't know, they don't take action. And it is important that they become aware now. Awareness for organizations to promote is good, but government also have to come in as a matter of policy to bring information to people. We are talking about the effect on national issues.
Yeah.
Because as it affects an individual, so it affects families, so it affects states, so it affects the nation. When we had colonial administration, there were a lot of traumatic issues that happened at that time. When we had the Civil War, a lot of traumatic issues also happened, you know, in the psyche of the nation, not just the individuals. To communities that have intertribal wars and intertribal challenges create also psychological and emotional discomfort among the communities. And these things need to be addressed professionally by the by not only the communities. Government has to come in. I was addressing a particular individual and said, look, the government can come in here to provide training, so that people, awareness training, so that people will become aware and so that they can go for healing.
Yeah, doctor, you I will come back today. I will ask this question because I had a guest here and she was saying that she heard that when a child is traumatized, and you mentioned that in the course of this discussion, it will go into the child when the child is even in the womb, and that affect the behavioral pattern of the child. And now I will ask, is it like today, these Gen Zs, the younger ones today in this generation, their attitude, could it be a part of what we are talking about being, I mean, taking in what the trauma the parents or the mother went through?
Yes.
So how is that affecting this one? How is it affecting the behavioral pattern of today's generation?
This is exactly what we are talking about, because these things are based on researches that have been done, not in our environment, but in other places where they are conscious of the effects of unresolved trauma. So I had a case, you know, let me give an example of a young chap who will suddenly forget things, and whatever she has, you know, we drop. And they brought her to me. We, you know, did we did the therapy. She became stable in that challenge. After 6 months, the thing reoccurred. So when they came back, I now asked, what happened to your mom when you were
pregnant?
When she was pregnant? Do you have any story? She said no. I said, okay, go and ask your mom what the challenge she passed through when she was pregnant with you. She came back after a few days to say, doctor, my mom said she had difficulty trying to deliver me. And at a point, she almost passed away. She was resuscitated. So within that period,
at the point of labor?
Yes. Within that period, there was a frozen energy as a result of that challenge the woman had. And that frozen energy is recorded and captured in the memory of the child. So anytime it plays to that point in the cycle, she herself, not the mother this time, will lose memory. So we had to go back to heal that problem, using her to heal the mother's challenge, trauma at that time, and she became okay. So these things are not stories, as it were. They are practical things that do happen. When the child that is in the womb, when a lot of women go through cesarean section. Now, at that time, you know, before now, cesarean section is knife. The approach of the knife into the body
will traumatize the child.
Sends signals to the child, and the child cringes. Women who are sensitive, they will notice when the child, you know, cringes.
Okay, doctor, before we continue with this show, let me go on a short break. Please, we'll be right back. You are welcome back, and we are still on Generations Gist with Joy, and my guest in the studio still remain Dr. James IWOWARRI. Doctor, you were talking about the trauma the baby feels at the point of birth. How does that really affect the child? To be brief about it.
No, the child gets traumatized, because there is an approach of knife.
And does that affect the behavioral pattern of the child in adulthood?
Of the child yes.
And can that be treated?
They can be treated.
Okay. Now, why I asked that question is that we have been witnessing a lot of different level of atrocities. Is it as a result of a failed society, wickedness, or even trauma? What could be responsible for? And there are cases like that. I've seen one day before yesterday, every day you kept seeing people like they want to kill girls, do this to make money. Is it as a result of a failed society, or is it as a result of their own wickedness, or maybe value system, or what? Or is it trauma?
I won't say it is the case of failure of this system or failure of the value system. A lot Nigerians have very high value, value for life, value for friendship, value for relationship. When there is a bad thing, you will see a lot of people commenting, but this thing is not so there is still that value. But there are people who have gone through experiences in life and have developed coping mechanisms. And some of those coping mechanisms are negative coping mechanisms. And they are, because they have not gone through the right healing, they are not able to engage themselves in a proper way. They've lost the will to be whom they are supposed to be. And so they are under different influences. So this is the reason. And it is rooted in unresolved trauma. I talked about adverse childhood experiences. When children go through negative experiences, it makes them to develop behavioral patterns as coping mechanisms. And those behavioral patterns can lead them to something outrageous and atrocious in future. Because people's behavior, people's experiences in childhood shape whom they become. These are based on researches. Case Permanente did a study on adverse childhood experiences. And you see the consequences of unresolved adverse childhood experiences in the future behavior of people. When people are have post-traumatic stress disorder, they develop capacity to do certain outrageous things. You can't believe that human beings can do this thing, but they need to be supported in the effort to transform them. So, the challenge we have now is that because of abandoning people in their negativity, so many people have now they see what they are doing as acceptable to the society, and people are now joining. Before, a parent will shout at the son when he goes to pick pencil from that doesn't belong to him. But now parents are buying computers for their children to go and do Yahoo. So can you see
parents?
Yes.
Parents will buy computer for children to go and do Yahoo.
You are not aware?
I'm not aware, doctor.
Okay. No,
I'm not aware.
Go do a research. Carry out the research.
Jesus.
Yeah. No, that is part of the challenge. When we don't do research in this environment.
What I know is that parents, anyway, it's possible. Parents could pay money to teachers for WAEC and all those things. So now it's not a norm.
Fine.
So it's not a norm, but now
when you do that as a
buying
parent,
computer for Yahoo.
Wait, when you do that as a parent, what do you expect of that child? Because you have laid the foundation. What do you expect of that child in future? He or she will think that is a norm, so you can't. And that is why there is decadence in the society.
Okay.
Yeah, because these are negative responses to traumatic experiences. And why are people doing that? The structure of the system is creating that trauma that a child is able to read and get 200 over 400. He doesn't get admission. Another person, because of where he comes from, another person gets 150 or 100 and gets admission. So the trauma associated with that discrepancy or disparity will make the person, what's the response now? Whatever they can do to get 400 so that they become merit candidate, they will do it. So structural system in the society can trigger traumatic experiences that will trigger responses that are not wholesome. So I call them life event experiences, and then the writings on our wall process those life event experiences, and it will lead to a behavioral pattern, either acceptable or not acceptable. So for you to now have an acceptable behavioral pattern from the society, you will need to look at the writings on the walls and try to correct the negative ones, clean up the bad ones. And that is what energy therapy now comes into do. So people who are displaced in their environment as a result of insurgency, now they are denied of opportunity to be in their ancestral homes. They are dislodged, and where they are kept, no much attention is given. They are not, their mental health is not excellent. It's not been administered to. It's not been attended to. What will you expect their behavioral pattern to be? It will be a
even when you go there, speak to them, and there is nothing coming, no form of support is coming. I mean, it still remain like that, and the mental balance will still remain like that. The trauma will still be there.
Yes,
but you cannot actually wipe away the painful trauma, especially the loss of members and all during those cases. I mean, how are you able to now, with your healing therapy, how are you able to now come in there? Again, before I go there, I was going to ask you, are Nigerians traumatized? Because because see, those days,
yes,
during the time in the 60s, I hear that a lot of our men, they sponsor them abroad to study because there are better education there and all those things, Then now people are not just going there because of maybe they are sponsored to go and study to come back and better Nigeria. They are jackpying. They are all jackpying. Is it as a result of trauma? Sir, you are in this in this field. Is trauma part of this jackpying syndrome?
Trauma is part of it. Trauma is they are going out because they think it is going to be easier for them. It may not necessarily be easier. The mere fact that somebody is not actualizing his or her potentials in an environment can be traumatizing for the individual, and he wants to look. The solution may be, let me go out to where I can actualize my potentials and my dreams. Yeah, it may not necessarily be correct, but you see, I want to also talk about expectation and reality. What happens to a lot of people is that what traumatizes a lot of people or creates a lot of deeper level stress is because their expectation is not meeting their reality, or their reality is not meeting the expectation. So there is a gap within that space, and how the individual reacts within that space is what we are talking about. Some people will go to the extent of committing suicide. Yeah. Some people will carry a weapon and do a lot of things. Some people will steal. Some people will. Very few people will get to the point where they will say, and so what? And this is what we try to achieve through therapy, to help the individual to come to terms, with the fact that yes, this thing is not meeting your expectation, but you don't need to be too stressed within that space. If you are stressed, you will not be composed enough. You will not be able to think stressed. You will not be able to take effective decisions. You will not be able, because your energy level will even be very bad. The color of your energy will be so bad that you are not able to attract the good things.
As a result of this, they are saying now, is mental, emotional trauma a public health issue?
It is a big challenge, a public health issue. It is. You ask a question, are Nigerians traumatized? I don't need to say yes for you to know that yes, Nigerians are traumatized.
They are traumatized.
Somebody did a study, one of the psychiatrists, he said there are 40% of Nigerians are traumatized. But I think the number is much more than that. Okay. Because anybody I talk to about trauma and emotional health, he said doctor, I am traumatized. Everybody in my family is traumatized. You know, they may not be talking from a professional perspective, but it is the feeling that they have about where they are supposed to be and where they are and what is happening around them that is causing it. You know, level of contentment has diminished so much so that people's expectations about themselves, about their environment, about the society has gone haywire, and they are not meeting those expectations, and it's causing problems. So a reorientation has become necessary, and not political reorientation, but mind. I'm talking about mind refinement therapy that will help people to come to an understanding of their purpose in life. The purpose that they are pursuing may not really be the purpose that they are supposed to be pursuing. And because you are not pursuing the right purpose, you are not at peace with yourself, and that is causing problem. So in energy therapy, we help people to come back to whom they are supposed to be, to appreciate life, that, you know, things, ups and downs will happen. And when they do happen, what are you going to do to ensure that you maintain stability within yourself?
Having said that, what exactly, you know, now I have to come back to your own profession now, because we have the psychiatrists, doctors, we have the psychologists, like you are now an energy psychologist or therapist. You know, what exactly is energy healing, and does it really give permanent solution? Is it a kind of magnetic this thing, you know, the energy healing?
Energy healing or energy therapy is a drugless health improvement method, and it has become significant because we as human beings, we are energy, and we create negative energy through our thoughts and our actions. Now, when we create this negative energy, when something bad happens to us, when we get angry, when we get furious, when we become afraid, we create negative energy. And this negative energy does not leave, doesn't go away. It gets stuck in our energy system. Because we are energy, we need energy to survive, to move around. And that energy gives us life. When that energy ceases to come in, something bad will happen. And this energy is called life force energy. The Chinese got to know about it over 5,000 years ago, and they called it chi. You know, the Indians call it prana. So that is where they got pranic healing. Now, this energy, now in modern science, we call it life force energy. This life force energy comes into us. If it doesn't come, it will affect the function of the organs in the body. Now, what we do in energy therapy is to remove the energy blockages that we have created, that or has happened in our energy system as a result of the anger, the negative emotions we have generated. Yes, there is also the environmental factor, electromagnetic frequencies that are not in harmony with with the frequency of our own energy. We create distortion in our own energy system, and that will create sickness or disease in us. So we need to remove all the bad energies that do not allow our energy to express itself fully and optimally. And this is what we do with energy healing or energy therapy. Now, how is it done?
Yes, is it electromagnetic?
Well, you know, science has been struggling to cage the energy in order to make it available, commercially available. Yes. So that is where you can see a lot of items being produced, especially in China. And say this, if you take this, it's energetically charged. It will help balance your energy. They make pendants. They make this thing. Those things can work, but they need to be checked to ensure that when you are wearing it, it is in agreement with your own energy frequency. Because everybody has energy signature. And energy signature that is not in agreement with your own signature will cause a destabilization. And that will cause problem. So if you are using any of those items, you need to check that it's in agreement with your own energy, and there are ways to check them. If you bring them, I will check you, and they will say, okay, this one is good for you, this one is not good for you.
Okay, you also do that too.
Yes, we can check the distance.
Okay.
But the energy therapy we do is it doesn't have any equipment, it doesn't have any product.
For real?
Yes. With my hands and my mouth, through the power of the spoken words, which contains frequencies, you need to arrange words in such a way that it can go into your energy system and cause a dissolution or a resolving of blockages in your energy system. That's where the training comes in. Then the hand, I don't know if you have heard of acupuncture.
Yes, I have.
Acupuncture and acupressure, they are also Chinese methods of removing energy blocks that are affecting the individual. Now, the difference between acupuncture and what we do is that acupuncture, you need pins and needles.
Invasion.
Yes, it's invasive. So in energy psychology, energy therapy now, it is non-invasive.
Okay.
We use just the hand. There are points in the body that are coded points where energy is held. And when the energy runs through, there is there are pathways called meridians. Energy runs through these meridians, and there are also centers of the body that are open and receiving energy from time to time, continuously. So these centers, they are called energy biocenters now in science, scientific documentation, but in the olden time, the Indians called it chakras.
Okay.
So these chakras, there are major 7 ones, and there are other smaller ones. These are centers that take in this energy and they go through the meridians.
Okay.
Now, if you have created negativity in your energy system and there is a blockage, this energy will not go through the meridians because it is blocked along the meridians. So when you do acupuncture using pin and needle along the meridian line, you are opening up the points for bad energy to go away.
So in other words, what you are saying is that in your own place, without invasion or medical, you heal with your hand and spoken words, and trauma patients gets healed. Okay, healed now. Or not cured.
If something was disturbing you and you remove it, you are cured of that thing.
Exactly. So like I've asked you whether it is healed, it can be healed permanently and the person will not go back to that. Yes. Okay. Now, where is the relationship between the psychiatrist doctor and the energy therapist?
Both of them are supposed to be working together. If the issue has gone to the borderline, and the psychiatric will bring, there are modalities that he is trained to deploy, and he is also trained to deploy medication to help the individual to come to a level of stability. When the person has come to that level of stability, the next thing to do is to find what is the root cause of this problem. Okay. So when you get to the root cause of the problem is now where the energy psychologists will come in, or energy therapists will come in. Because we are talking about trauma. If the challenge is emotional health, then there is need to correct that emotional imbalance in the individual, so that the person does not go back to where he was before the psychiatrist came in.
Okay, that means they will have to see you first before they go to the psychiatrist. It is possible
that depending on the nature of the challenge, if the person has become violent as a result of uncontrollable behavior,
they will need a medical.
The challenge had been allowed to fester,
escalate,
to stay for a long time. It now escalates into neurological challenges, and there is no balance. Then the psychiatric has to come in.
So that's the last resort.
Yeah, get the person stabilized. Look at him over a period of time. But there is need to do other things so that there is no relapse. Okay. Yeah. because sometimes you stabilize somebody and the person is on drugs or medications, and that medication is not supposed to last for a long time. But because of the way things are, some of them are put and kept on such system for life, so that the person is able to continue to function. But the reason for that is the fundamental reason for that particular manifestation has not been removed. So when you address the issues, the thing will go away. Okay.
Now the energy therapists, like as you now, do they give support? And I know they give healing now. They support in giving healing, like those psychological support or social support. For example, the energy centers, do they actually work hand in hand with those people that give social support, which is also part of the healing process?
Yes, medicine as the health as described by World Health Organization is not the absence of infirmity, but effective functioning at the level of physical, emotional, psychological, and social. And even somebody said, oh, they removed spiritual and put social. That's also spiritual. So these are the totality of what makes a person. So care also should go through that path. You take care of the physical, you take care of the emotional, you take care of the psychological, you take care of the social aspect of the individual. So all these will come together to support the person. As an energy psychologist or energy therapist, my role is to look at the aspect that will support the psychological and emotional well-being of the individual. Social may be government coming in, give them money, like it happens with the children that were kidnapped. When they are recovered, government gives them food, give them money, give them dresses,
and even education.
Educate them. But the cleaning up of the trauma of being exposed in the bush, being exposed to other areas,
they can't do that.
Seeing them maybe dismember people or something.
So now let me ask you, for lack of time, as an energy therapy now, how are you promoting this energy therapy in Nigeria in terms of advocacy, training, and awareness?
I started in 2005, got the formal training in 2007 to 2009. Since I came back, talking about this, I've been doing workshops, I've been doing community energy health projects. Go to communities and go to urban palaces, go to chiefs and talk to their people. We have what we call energy therapy to school program, where we go to schools to talk to the children, pupils, because a lot of children come from dysfunctional homes, and they come with a lot of trauma. When you ask them questions, and they are absent-minded, they don't understand what's going on, but they are present there. So we help them to appreciate, the significance of negative emotions that they are building up, and then how to resolve them. We teach them techniques that they can use. So I do workshops, I do certification trainings. I have Golden Rays Integrated Energy Therapy Institute in Nigeria, and I run programs sometimes once in a month. In fact, I have one next week, starting from Monday. It's a 5-day certification program. So these are avenues
on energy therapy. And free? Is it free?
No, it cannot be free. I spent millions to acquire the knowledge.
In 30 seconds, what advice will you give now to younger people, or parents, families, government on energy therapy in maybe 20 seconds? Government,
parents, everybody that has authority should embrace energy therapy. It is very, very important. Energy therapy is a tool that you can use for emotional trauma first aid. When people get physical injury, they go to hospital and get first aid. Otherwise, the injury festers, and they can amputate somebody's hand or leg. When people get emotionally hurt by whatever means, they need emotional first aid to take it out immediately.
Okay, that means even the people around them should now make them access energy therapists.
Yes,
And
exactly.
Thank you very much, Dr. IWOWARRI, for coming on this show. I'm really glad to have you here. And honestly, this is an ongoing topic. We need to continue on this thing because many people need to be aware about energy therapy in Nigeria. It's very important because a lot of people are traumatized. Thank you very much for coming on this show.
Thank you for having me.
Thank you, Doctor.
I appreciate
it. Yeah, they said information is knowledge, and you've had enough of trauma and how it can be solved without even going to the psychiatric hospital. First of all, I think the first point of call will be energy therapy, and you can access them everywhere all over the country. And this is the much you can take on this episode of Generations Gist with Joy. But before we go, don't forget to always be a part of this show by following us on all our social media platforms. For further inquiries and sponsorship details, please send an email to generationsgistwithjoy@gmail.com. Until I come your way, same time next week, remember your generation is your identity. Let us always be our brother's keeper. Remain a patriotic Nigerian. I am Joy Onu. See you next week.